Welcome back. Today we will focus on ethical issues in group, couples, and family counseling. When addressing ethical standards in these contexts, it's essential to understand that confidentiality cannot be fully guaranteed. This is because third parties are involved. Whenever a third party is part of the counseling process, it becomes ethically and legally challenging to ensure complete confidentiality. There are situations and circumstances beyond our control that can make it impossible to guarantee confidentiality. In these settings, and in this lecture, we're going to explore the nuances of ethical considerations and standards and issues specific to group, couple, and family counseling. So let's begin with families in particular. Here's the question that may seem fairly simple. What is a family? How would you define family? Take a moment to reflect on that and come up with your own definition. Your definition of family is often shaped by your lived experience with your family unit and how you have come to understand family over time. If you ask friends, loved ones, or other family members, this is the same question, and each of you would likely have very different responses. While there may be similarities, there will also be significant differences, and this variation arises because the definition of family differs across culture. It may evolve as you grow. What you identified as a family when someone asked you at age 10 may look very different at age 20, 30, 40, 50, and so on. This shift reflects profound life experiences that impact general aspects of the family unit. The family is, in fact, a system. In the counseling profession, we focus on family members and how they interact with one another, the transgenerational dynamics, and the circular causality. Often, family members come into counseling identifying a problem, such as one person, let's say Sally, she's unable to maintain employment, displaying outbursts of anger and causing disruption in the home. In these cases, the family may view Sally as the problem. However, the concept of circular causality suggests that the family as a whole shares the responsibility in the situation. Instead of focusing solely on Sally, we must help the family recognize that the problem may be rooted in broader dynamics. For example, Sally's angry outbursts and difficulty maintaining a job may be linked to underlying issues, such as abuse in the home or a younger sibling who Sally feels obligated to care for. These are the kinds of patterns that we examine in family counseling, where circular causality plays a key role. We must acknowledge that various factors contribute to the formation and evolution of family dynamics. Some old patterns may resurface while new ones develop, influenced by factors like finance, socioeconomic status, emotional functioning within the home, and the history of bonds between family members. Have family members had healthy or conflicted relationships? Have they been estranged for years? These patterns must be understood in order to grasp the full scope of the family dynamic. As a result, each person's definition of family may differ based on their unique experiences and perspectives. With all this in mind, ethical issues will inevitably arise in family counseling, and it's essential to be well versed in the ethical standards that govern this type of work. Families come in many different shapes and sizes and forms. As a result, family counseling must address a variety of dynamics. There are traditional families who are what we might call nuclear, dual career, dual income families, and sometimes dual income families may or may not have children. The presence or absence of children significantly impacts the family structure and relationships. Additionally, many families are aging, and that comes with unique challenges such as empty nest syndrome, grief, loss as family members grow older. And in these cases, family roles and responsibilities may shift and change, and sometimes adult children are required to take on caregiving or other responsibilities within the family. Culture plays a key role in shaping family dynamics. For instance, in some cultures, children are expected to never challenge adults within the family. But what happens when adults age and they need assistance? In some situations, children may find themselves assuming adult roles, navigating responsibilities such as caregiving or managing legal matters. And these are common challenges in families dealing with aging parents and shifting roles. Single parent households are also a significant area of focus in family counseling. A growing number of families are affected by parental incarceration, leading to absent parents, and creating challenges for children who are raised without one or both parents. These families face unique ethical issues, especially when compared to households with two or more parents. Childless couples, whether by choice or due to infertility, also bring a distinct set of concerns to family counseling. Infertility rates are high, and couples may experience grief or loss over their inability to have children. Alternatively, some couples are content with their family unit as is, defining their family as the partnership between the two individuals. These situations require sensitivity to the emotional impact and the choices made by the couple. Multi-generational families, where multiple generations live under one roof or maintain close relationships, also present unique dynamics. These families may face challenges related to caregiving, intergenerational conflict, or differing values. Similarly, families evolve over time. Parents may remarry, forming blended families or step families, and adoption introduces new relationships and responsibilities into the family unit. LGBTQ plus families are increasingly seeking counseling to support and address unique challenges, including social stigma and the need for inclusivity. As societal trends shift, it's essential to support these families with care, respect, and understanding, ensuring that they feel accepted and valued. It's important to remember that individuals have the autonomy to choose who they seek for counseling and for support. With autonomy is a privilege and a responsibility for counselors to respect and honor. We must always approach these families with sensitivity, ethical integrity, and a commitment to supporting their needs in an inclusive and affirming way. Family therapy differs significantly from individual therapy in that it focuses on making changes to the entire family system rather just one individual's experiences. While individual therapy can certainly have a broader implication, family therapy ensures that everyone in the family receives the same message at the same time, working collaboratively on systemic changes within the family unit. This opportunity to address the collective dynamics is not present in one on one therapy. Additionally, individual and family life cycles play a critical role. While individuals go through various life stages and experiences, families also have their own cycle that evolve over time. In family counseling, it's important to recognize and navigate both individual and developmental and changing dynamics within the family unit. The therapeutic work often involves balancing the needs of individual family members within the overall family system and understanding how their interactions and roles impact one another. In contrast to group counseling, which focuses on interpersonal changes within a group, family therapy emphasizes systemic changes within the family structure, addressing both individual and collective issues simultaneously. In family counseling, there are several key ethical considerations that must be carefully considered. One primary key issue is privacy, confidentiality, and privileged communication. As we mentioned at the beginning of this lecture, confidentiality cannot be fully guaranteed in family counseling due to the presence of a third party. The involvement of multiple individuals means that privacy cannot be ensured in the same way that individual therapy can be. For more information about this, I encourage you to refer to Ethical Standard B6E. Divorce and child custody issues are also common concerns in the family counseling. Family dynamics are often affected by life cycle transitions, such as divorce, which can lead to struggles with communication and adjustments within the family unit. If you're working in an agency that conducts child custody or child welfare assessments, your approach will differ from an agency that does not. In cases of legal custody agreements, it's essential to be aware of the specific legal stipulations that apply, especially if custody issues are a part of the family counseling process. Family secrets are another important consideration. In family counseling, the family as a whole is the client, not just one individual member. There is no single identified point person or primary client in the family unit. This dynamic requires careful attention to ethical considerations. For additional guidance on this, I will refer you to Ethical Standard B4. B. Regarding divorce and child custody, it's crucial to ensure that you have proper documentation regarding the legal guardianship and custody arrangements of the children involved in therapy. This includes confirming who has the legal right to make decisions for the child and whether they have authorized the child's participation in therapy. Failing to confirm this could lead to ethical and legal issues, such as providing treatment to a child under the consent of someone who does not have legal guardianship. Always request the necessary documentation up front to avoid complications. Family violence is also a significant issue in family counseling. Studies indicate that 50 to 60% of couples seeking counseling have experienced at least one instance of violence in the relationship. It's important to be aware of the potential for family violence and understand the dynamics of the population you're working with. Be mindful of signs of domestic violence, even if they are not explicitly mentioned. This requires a nonlinear approach to counseling where you stay attuned to subtle cues and clinical impressions that may suggest violence in the home. If family violence is identified, this can present ethical dilemmas about whether an abusive family member should be included in family sessions. We must carefully consider the impact of their involvement on the safety and well being of the family unit. Transparent discussions about safety and the potential harm or benefits of including the abuser in the counseling process are essential to ensure that all parties are protected, and the safety of the clients should always be a top priority. As we begin to explore ethical and legal and cultural issues related to group counseling, it's important to recognize the key differences between family and group. In group counseling, members typically don't know each other beforehand, and they probably don't have any personal relationships outside the counseling environment. This contrasts with family counseling, where members share a pre existing bond and history. In family therapy, clients are working with individuals that they know intimately, while in group therapy, participants are asked to trust the group, the therapist, and the process despite that lack of familiarity. Regardless of whether we're working with families, couples, or groups, it is crucial to establish norms, rules, and roles early on in the counseling process. In group counseling, setting these expectations within the group itself is essential. For family counseling, it's equally important to have conversations from the start about what participants can expect, particularly around confidentiality. While confidentiality cannot be fully guaranteed in group therapy, it is important to emphasize the significance. As a therapist, your professional ethics and welfare of clients are at stake. Ensuring that everyone understands and respects confidentiality is crucial. For example, if a group member breaches confidentiality by disclosing sensitive information shared in the group setting, this is a serious violation. In such cases, I would have to ask the individual to leave the group, as maintaining the trust and safety of the group is paramount. Breaking confidentiality is not something to be taken lightly, and it should always be addressed as part of the broader conversation about safety, trust, and the impact on the group dynamics. These conversations should include questions such as: what happens if confidentiality is violated? What are the consequences for the individual involved? Is the breach dependent upon the context, content, and recipient of the disclosure? By having these discussions up front, the group can collaboratively agree on guidelines that promote emotional intelligence, mutual respect, and the safety of all participants. This shared understanding helps ensure that everyone in the group feels secure in expressing themselves and that the therapeutic environment remains a trustworthy and productive experience. Ethical considerations in group, family, and couples counseling include critical issues of informed consent. While the importance of informed consent applies across all types of counseling, it is particularly significant in group and family couples therapy. In this setting, we must clearly outline the nature and limitations of confidentiality, emphasizing that we cannot guarantee it. This is not a one time conversation, but rather an integral part of the therapeutic process. It is essential to ensure that clients are fully aware of their rights, including any differences based on the type of therapy they are receiving, whether in private practice, community counseling, or inpatient hospital settings. Furthermore, we must address the potential risks and benefits of treatment, providing clients with informed necessary to make informed decisions about their participation. If the client decides to revoke their informed consent, we must be prepared to discuss what this decision means and the implications for their treatment. It's crucial that we take time to explore these matters thoroughly with our clients. The professional disclosure statement is another key ethical requirement. As discussed throughout this course, therapists will need to be ethically obligated to present themselves professionally, clearly communicating their qualifications, credentials, and experience. Licensing regulations often require therapists to display their professional licenses in their office. So think about how you might see a doctor's credentials displayed in their office. Similarly, licensed professional counselors should make their credentials visible. However, it's also important to consider personal safety. While the safety of our clients is paramount, we must also protect our own safety. For example, if a client exhibits aggressive behavior, brings a weapon into session, we must set clear boundaries, and such actions that threaten our safety simply cannot be tolerated. Additionally, when displaying your professional licensure, it's common for the license to include your home address. To protect your personal privacy, I recommend covering your home address on your license when displaying it in your office. This is a personal choice, but it's one that I believe can be very beneficial in terms of safety. As a therapist with a background in forensics and criminal justice, I don't display things like that in my office just as a precaution to me, and I believe that that's very valuable. This is a decision that you need to make based on careful consideration, the best interests of yourself and your clients. When discussing risks and benefits, we must consider not only the client's well being, but also our own. Policies and procedures must be explicitly outlined to ensure clarity and consistency. For example, what is your attendance policy and what happens when a client misses multiple sessions? How do you follow up with clients who have been absent for an extended period? What is the process if you need to close a case due to noncompliance or if a client leaves against medical advice? Similarly, the grievance policy should address the steps a client can take if they wish to reenter treatment. Fees may also play a crucial role in the counseling process. In some cases, fees are covered by a third party insurance, but in other circumstances, clients may choose to self pay or utilize a sliding scale. Clients have the right to self pay even if they have insurance coverage, particularly if they prefer not to have a diagnosis included in their medical record. It's important to respect these decisions and be clear about fees, as noncompliance with payment obligations may raise ethical concerns. In such circumstances, therapists may need to make ethical decisions about discontinuing services based on payment issues in alignment with agencies' policies and professional guidelines. When considering the risks involved in group counseling, it's important to be aware of the potential misuse of power, particularly by the group facilitator or the co facilitator. There is a need to be conscious of both overt and subtle power dynamics in the group. For instance, where you sit in the room can influence the group's perception of authority. If you're in a consistent seat each session, consider the implications, especially if you have a co facilitator. Ideally, your co facilitator should sit across from you, not directly next to you, to show that you're both equal participants in the group process. The arrangement of seating and personal space can also subtly affect the group's dynamics. For example, in some groups, people may leave certain seats open near the facilitator's chair, creating a power dynamic where those arriving late are indirectly punished by having to sit next to the leader. It's important to break away from complacency by varying your seating and encouraging group members to engage with each other. By fostering discomfort in a safe, structured environment, you can create opportunities for growth and change. Self disclosure is another area for consideration. A cultural context of self disclosure is crucial, as some cultures have prohibitions or taboos about sharing personal information. The intent behind self disclosure from a counselor's perspective is also essential. When you self disclose, ask yourself, what is your intent? What did you hope to achieve by sharing this information? Was it related to the specific client or the situation? Be mindful of your intent, as it ensures that self disclosure remains appropriate and beneficial, respecting both cultural sensitivities and the therapeutic process. Maintaining confidentiality in a group setting is also a critical ethical responsibility. As a group leader, it is your duty to ensure that group members understand the importance of confidentiality within the group and that anything shared in the group setting remains within this room. It is also important for the group leader to model and emphasize confidentiality, fostering a space where clients can feel safe and respected. Something that I often say in group therapy is it's kind of like Vegas. What happens in Vegas stays in Vegas. The same thing with group. What happens in group stays in group. Another challenge is managing scapegoating within the group. A participant may attempt to deflect attention away from their own issues by blaming others or projecting their feelings onto group members. These individuals might become passive or silent when confronted, but continue to avoid personal accountability. Group leaders must be vigilant in assessing this behavior and addressing it appropriately, as individuals who are quote unquote treatment savvy can sometimes manipulate the group dynamics. Additionally, subgrouping can occur, which may undermine group cohesion and create divisions that threaten confidentiality and safety within the group. Confrontation can be a powerful therapeutic tool, but it must always be balanced with empathy. Confronting a group member is not only effective when it is focused on specific behaviors and not judgmental of the person. Instead, targeting a group member's character, confront the discrepancies in their actions and their words. For instance, if someone says they're having a great day, but their body language or their tone suggests otherwise, addressing this discrepancy with curiosity and empathy. It's crucial to approach confrontation as an opportunity for growth rather than an attack. One way to minimize risks in group therapy is by establishing a clear treatment agreement or contract. This document outlines expectations, roles, and responsibilities, providing clarification for both the group leader and the participants. Having clients sign off on this agreement ensures that everyone is on the same page regarding the rules of the group. It can also serve as a reference point if any questions, concerns arise later, creating a framework for accountability and transparency throughout the therapeutic process. The ACA emphasizes the importance of clearly explaining the parameters of confidentiality in group counseling, highlighting that confidentiality is critical, but it also acknowledges that it cannot be guaranteed. According to the ACA guidelines, counselors are responsible for safeguarding the confidentiality of information, both prospective and of current clients. Information should only be disclosed with the proper consent or when there is a strong ethical or legal justification to do so. This underscores the need for informed, written consent, as verbal consent alone is not sufficient in most cases. While exceptions, such as during the COVID-19 pandemic, allowed for verbal consent due to the shift in distance counseling, these were temporary measures intended to avoid barriers to treatment. In normal circumstances, however, written consent is required to ensure compliance with legal and ethical standards. Ethics and diversity are central to group work, as outlined in the Association for Specialists in Group Work, which emphasize that group workers should practice with sensitivity to a wide range of client differences, including but not limited to ethnicity, gender, religion, sexual orientation, psychological maturity, economic class, family history, and physical characteristics or limitations. This cultural competence is crucial when engaging with diverse populations we serve, and it can be enhanced through both interactions with participants and through the use of external resources. In group counseling, it's essential to consider both group norms and cultural norms. As we establish group rules and roles, this process should be collaborative, ensuring that the norms align with cultural values and the needs of the members involved. If discrepancies arise, it's important to have open and sometimes challenging conversations to address these differences. Such discussions provide valuable opportunities to learn about each other's values and beliefs, fostering collaboration. Group settings can serve as a microcosm of society, and the work done within the group can have very far reaching consequences beyond the group itself. As a group leader, how will you establish group norms that ensure safety while promoting equity and fairness for all members? How will you educate and empower group members regarding social justice issues? How will you navigate challenges and challenging discussions about identity, culture, privilege, and oppression? How will you assess the impact of culture, age, gender, and values on the group process, the group dynamic, and the group's ability to progress through the stages towards successful outcomes? Additionally, how will you critically examine your own values, biases, misconceptions, and stereotypes to prevent harm? All of these are essential ethical considerations that require careful thought and reflection. In the midst of this work, it's crucial not to lose sight of how we manage these issues, as they significantly affect the group's effectiveness and ethical practice. Take time to thoughtfully consider these questions, seek guidance, and engage in discussions or brainstorm with others. Observe group settings, shadow family or couple therapy sessions. Curate an approach that aligns with your theoretical orientation, interventions, and personal values, and choose what best suits your style and the needs of the group. The key takeaway here is that in order to truly understand the whole picture, you need to look beyond the individual components. In family, group, or couples counseling, we must focus on the entire system, not just the individual. While each person is like a tree in the forest, they play a crucial role, which is incredibly important, and we need to take the broader perspective when providing this type of counseling. If you have any questions, comments, or concerns, don't hesitate to reach out, and I hope that you enjoyed this lecture.